Welcome back to the channel. Today's video is about meter dose inhalers. There's a lot of times that they're done right. There's way more times that they're done wrong. Let's get to the video. Go. So today I've got a couple different types of inhalers. So I want to give you some information about these inhalers. Now these are expired. They are real medications, but they are expired. So that's why I'm using them for this demo. You're going to notice a couple different things about a meter dose inhaler. So it has a propellant inside of it, and propellants have changed over the years. And we currently have, we've got away from CFC, so we use HFAs. HFAs, high fluorocarbon, something like that. I'll put it next to me. But I'll tell you a little bit about it. It doesn't propel the same way CFCs did. CFCs, the patients can really feel that hit their mouth, and I'm not saying that's a good thing, but with the HFA inhalers, if they've been on inhalers for a long time, they're going to feel difference when this comes out and goes in their mouth. Well, speaking of going in their mouth, that's not really where we want this medication to go. So let's first of all, we're going to talk about albuterol. So albuterol inhaler, of course, you know, albuterol is a fast-acting bronchodilator, works in usually 3 to 5 minutes. Inhaled form, we also have it in nebulized form. You see it given nebulizers a lot, but MDIs are really effective. But the main problem is our delivery is really poor when we do inhalers. So a couple positives about inhalers. They're super portable, right? Put them in your pocket. There's not much to them. It's hard to have a portable neb, although they make some small ones now. But it's really hard to have the portability that this does in a nebulizer. But one of the big keys to any kind of MDI therapy, and we're going to just first start with albuterol, is using a valved holding chamber or a spacer. Absolutely key. Nobody should ever get an inhaler without also having a valved holding chamber or a spacer. Now, why do I say valved holding chamber or a spacer? Well, there's two different types. The best one's a valved holding chamber. It just actually has a valve that only allows the patient to take their breath in. So there's a valve inside of this. A spacer is merely that. It's just a tube that kind of holds the medication. So valved holding chamber, this is one of them from Vit Labs. This is just a pretty common one that we have. And it actually collapses, which is nice because that is one of the big downfalls of a spacer. It's like this and this in your pockets quite a bit, whereas this is much easier. But with a spacer, you're going to get so much more medication, usually 2 to 3 times more medication per dose. Think of it this way. So let's say you have a headache and you're going to take your standard 2 extra strength Tylenol, but because you can't deliver it appropriately, you're only going to take your 1 Tylenol, your 500 milligrams instead of your gram. So how much do you think, what effectiveness do you think that would have for you? Think about it with ibuprofen. Taking a third dose or a half a dose of ibuprofen than what you're used to. It's just not going to work as well. And that's why people don't use MDIs as much, because they don't use a spacer and they can't get the medication in the way that it's designed to be given. Now, I think every time you get one of these, you should also get one of these. Now, unfortunately, these are a slight on the expensive side, but the great thing about them, they can be reused. This adapter on the back is really universal for almost all different types of inhalers. So there's some dry powder inhalers that you got problems with that kind of have their own delivery system. Respimat's another one that has its own delivery system, but let's talk about this one today. So first thing you're going to look at when you're taking any type of inhaler, you're going to have this is our medication in here. It comes out of the little port on this side, and there's a counter usually. This one is at 0 right now, but there's a counter, and that shows you how many are left on your counter. It also goes into a plastic sleeve that's kind of our delivery device. So this can be cleaned, these can be cleaned, and it's recommended you do clean them, especially because this actuator here can actually get kind of gunked up a little bit. So cleaning these things with warm water, warm to hot water, and then also using a detergent over 15 minutes and then letting it air dry works really well for this. So you can do that with almost all of these things. Same process with this. Warm to hot water, regular detergent, you're going to clean it out, and then you're going to let it air dry. It will clean out this too. So air drying is really important. Another key is do not dry it with a towel, because aero chambers can actually, if you use a towel, you can actually cause static inside of them. Well, when those particles are released from the MDI, they'll actually, if there's static inside of this, and this is non-electrostatic right now, but if I dried it with a towel, it might become that on the inside especially. It'll pull those particles in because they're really small and hold them to the wall of the chamber. Well, there you can lose up to 50% of your medication just from that. So don't use the towel when you clean this. So let's go through how you're going to teach your patient how to take this. So the MDI, of course, MDIs, you're going to go into here. You're going to shake it, okay? For at least 5 to 10 seconds, you're going to shake. What that's doing is going to mix the repellent and the medication together inside of here. So you're going to shake that. And if this inhaler has not been used, especially if it's a new one, we're going to give it a few priming puffs is what I would call them. So we're going to start with, these usually about 3 to 5 of them you're going to start with. And then if you haven't used it for a month, it needs to have pre-primed again. What's that going to do? It's actually going to move the medication down the actuator to be ready to deliver to the patient. Because you don't want to take, if they have 2 puffs ordered, you don't want to give them the first 2 that really is either all propellant or no medication. So let's do our prime. That's into the air, okay? You don't shoot at somebody or somebody's eye or anything like that. You shoot it into the air and now it's primed and ready to go. The next thing we're going to do is we're going to insert it into, in this case, an aero chamber, because this actually has a one-way valve, so it's a valved aero chamber. It's going to look something like this. So in this case, it's ready to deliver. This is the great part about an aero chamber, is it takes the whole part out of it where you had to puff and then take your breath really quick after it. Not that fast breath like that, but you had to take a breath right after it. So this takes all of that work out of it, because in the past without this, you probably see people do this a lot. Put this in their mouth, seal their mouth on it, blast it, suck it in like they're sucking down a straw, or something like that really fast. Those are 2 things that really decrease the amount of medication delivered. For one, going in your mouth, that decreases it. And for 2, the fast breath in. Things you have to remember about this. With the aero chamber first. So if I give a puff, the medication is actually going to be suspended within this aero chamber. You saw a little bit come out this side. But what you're going to notice is inside of there, it's going to dry it a little bit so that it's going to make it optimal particle size to get down to your lower airways. Usually 3 to 5 microns is what you need to be, really small to get down there. The next thing is we got to think about how are we going to get it down there? Do we get it by going like that, blasting it as fast as we can? Absolutely not. We have to go with a smooth laminar flow to get it down there. So think about this. If you're taking your breath in, almost like you're taking a cleansing breath. So you're going to take this breath in really slow. That air goes in at a smooth flow with a decreased amount of turbulence. Then you're able to deliver these aerosolized particles all the way down to your lower airways where they actually work. They don't work in the back of your throat. They don't work in your trachea. They don't work in your bronchioles. They need to get all the way down past your terminal bronchioles at the bottom. Smooth flow is really important. So let's go over this with our patient. Let's say they're ordered 2 puffs, okay? So the first thing we're going to do is have them shake. Okay, this has already been primed. We're going to have them shake. Have them fully exhale. Okay, notice where my hands are on this. If you put your hands here, this thing tends to kind of go down when you push on it. You'll see a lot of our older folks kind of do that. They'll kind of push on it and it doesn't really work well. Thumb here, finger here, or anything like this. This part stays attached. You don't have to hold on to this part right here. So, shake. We're gonna go like this. Fully exhale. Seal your lips on. And hold. And hold. And hold. And hold as long as you can. And let it out slow. What we're actually looking for is 5, optimally 10 seconds of a breath hold. Notice a couple things. I gave the puff. I started my slow, deep breath in until I got maximum volume in. And then I held it as long as I could. What that does, it gets it to the bottom where it really needs to work on those muscles surrounding the airways. and then it holds it there so that it can deposit into those airways and loosen those muscles. So that is super important to do. The puff, slow breath in, hold 5 to 10 seconds, and a slow exhale, that counts as 1. Usually, we're gonna wait at probably 2 to 3 minutes in between each puff. Standard dose is 2 puffs every, usually 4 to 6 hours, okay? So that might look a lot different than what you've seen Uncle Bobby take his inhaler. You know, if he took it really fast or like that, or blasted it 3 or 4 times at once, that's all wrong, because 80% of the medication in those cases splatters in the back of your mouth. Well, what do you get from that? You get side effects, right? You get maybe a little bit of fluttery feeling, or you feel a little bit flushed, or you feel like you have a little bit of caffeine buzz. That's all secondary effects, secondary side effects of not depositing in the right spot. So if you get an inhaler, you have to have a spacer or valve holding chamber. Now I'll show you a little bit different thing that you can do with a valve holding chamber that you can't do with a spacer. So let's do it again. And this is what I'll often do with my patients, just to kind of show them the difference between the old way and the optimal way to deliver this medication. So give it the shake. I'll have them fully exhale. I'll tell them to puff it, then put it in their mouth, and then breathe it in. It takes that whole part out where you puff and feel like you have to breathe in really fast, because think about this. A valve holding chamber holds the medication in there. You don't have to hit it. You don't have to take it right after. So let's do that one. Shake, 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 shake. 5 seconds. We're going to give the medication. Actually, we're going to fully exhale first. And hold. And I'm not going to hold for 10 seconds just because of the fact I'm on video. So I'm going to exhale after 5 to 10 seconds. So that's really important. I think that kind of taking the link out of giving the puff and taking the breath really helps a lot for your patients. And that smooth flow is gonna really deposit a lot of medication. So that's how to use a valve holding chamber. Now, this is Albuterol Bronchodilator. Of course, it works kind of quick. You don't necessarily have to rinse your mouth after bronchodilator, but you do after using any kind of corticosteroid or a medication that might be a bronchodilator and a steroid. It's really important to rinse your mouth after that. So after you do that, you rinse your mouth, swish it around as much as you can, and you spit it out. It's going to prevent thrush, because you're going to get some of that deposit in your mouth. No matter if you use an aero chamber or not, but especially if you're not using one, you're going to get some in your mouth. So in that case, like a Flovent, this is a Flovent Inhaler. It's kind of made the same way. As you can see, we know this is a steroid. And so this would be the same process. It'd be a shake for 5 seconds if it hasn't been used or it's brand new. 2, 3, 4, 5 into the air. Shake, shake, shake. Apply to here. We're going to go through the same process. Do the shaking. Fully exhale. Seal mouth. And hold as long as you can. Okay, so we know that's optimally 10 seconds, but 5 to 10 seconds is great. Then we're going to exhale. Let it out. There's 1 puff. This is usually two puffs, usually maybe in the morning, maybe at night. Probably usually twice a day, actually. And this doesn't work fast, so we don't expect it to. This is reduce inflammation inside your airways. So asthmatics will use this a lot. Even patients with emphysema, COPD, we're going to use this type of stuff. So that's a steroid inhaler. Hooks into this just the same. Now, every week, what you do with this is you take this apart any way you can. Usually they come apart in different ways, and that's when you're going to clean it. So you're going to use lukewarm to hot water. You're going to use a detergent. You're going to scrub it out, let it air dry. It'll be good to go. This one collapses, so it fits nicely in your pocket. It's good to have, delivering 2 to 3 times as much medication as you do with just doing it the old school way. Now, let's say you don't have an option. Right now I have an inhaler, and I have to have my inhaler, but I don't have an aero chamber. So for one, you need to try to get one. So your local pharmacy, talk to your physician. You need to have a spacer. I'm just telling you, if you have an MDI, this is like taking 1/3 of your dose of Tylenol, because whatever's prescribed for you, you're getting 1/3 of it by not using this. So you're wasting money too, because these are not cheap. I know it. They are not cheap, and a lot of people are on fixed budgets, so you cannot tend to spend extra money. You want each time you take this for it to work, especially if you're only taking it PRN. If you're only taking it when you're short of breath, you want it to work each time. So let's say, Jimmy, I don't have the option. I don't have an aero chamber right now, so I've got to do whatever I can. Here's the best way to do it without a chamber. So same as before, you would prime it however it be. This is different than what you've seen in the past. So you're going to take it to your mouth. You're going to do 2 fingers outside. Okay? This is outside. 2 fingers outside. You're going to have your mouth open. So what you're trying to do is you're trying to create a reservoir inside of your mouth and oral pharynx for this medication. When you puff it, it comes out, for it to kind of go in there and you to take it in slowly. Okay? If you do this, you're sealing your mouth around it. You might be sealing it in, but you're blasting it all over. 2 fingers away, open mouth technique. So, fully exhale. 2 fingers away, open mouth. I'm going to start my breath in. And I'm going to do my up to 10-second hold. So you notice that's a little weird. If you ever seen somebody in public take their inhaler out here, you might have been like, what is the deal? They're doing it wrong. Actually, I see them, I say, they had somebody tell them how to do it the right way, because it should never be sealed in like this. So show it again. Fully exhale. 2 fingers, open mouth, start the breath in, and then when I hit this, when I start the breath in, it's going to fill that oral pharynx, and I'm already pulling air down at a smooth flow. Not like this. Nothing like that. Like this. Slow, smooth, laminar hold, and exhale. So, do it again. Shake, shake, shake. 5 seconds. Fully exhale. 2 fingers, open mouth. And hold up to 10 seconds. Exhale. And that's a way better way to deliver medication than you've ever probably done before, and it might be a lot different also. Aero chamber, valve holding chamber, spacer is the best option. That is a good secondary option, is to do that. You can also use, and this is really generic, but if you want to improve the amount of medication you get, we were actually taught in respiratory therapy school to tell people to use toilet paper rolls. So after your toilet paper roll is done, that is a perfect cylindrical size to work for a spacer. It's not valved or anything like that, but it's a spacer. So you can do that, and that will act as a reservoir to hold that in while you take that in. Now, obviously, that's going to be like you use it for a couple days and throw it away, because that will get kind of wet and stuff like that. So it's obviously not cleanable. But optimally, you need a valved holding chamber with any type of inhaler. I hope this helped today. If you have any comments, please put them below. If you have questions about inhalers, about things you've been taught, and any other suggestions for videos, please let me know. And I hope that you're able to share this video with people that you know, and you're also able to help the patients that you're taking care of, and that your care will be better for them because of some of the things that you've seen today. Thanks for watching. I have a little bit of bonus footage for you because I want to talk about a device that works really well for you to optimize the therapy you're giving to your patients. So if you're working in an office, you're working with anybody with MDIs, an in-check valve is really, really important. So let me show you the down and dirty of how this piece of equipment works. It's really great. It's a great thing to have. It's actually, you can use one-way valves on it, so you can use it with multiple patients. But let's get to that real quick, and I'll show you how we can optimize our therapy for our patients with this device. An in-check dial, or in-check valve, as I would call it, is a training device. And what it does, it makes sure that your patients can give the right amount of inspiratory flow for the medication that you prescribe for them. It's so important, because if you prescribe somebody a DPI, as you can see here, and they cannot generate at least 30 liters per minute of inspiratory flow, which takes quite a bit through these resistive type devices, they can't get in the medication. So they're going to be paying hundreds of dollars per month, and they can't get the right medication. in-check device is great for that because we can check our patient to see what kind of inspiratory flow they need. It's also a great trainer for MDIs because it helps to show the patient how slow they need to be going for MDI therapy. So let me show you a little bit about it. Inside of it, it has a little plastic ring in here, and it also has a spring on it. And what it's going to do is this little red aspect right here is going to move to whatever their inspiratory flow is. On this side, it has a dial, and this dial actually allows you to change the flow coming into the device because all these different devices are going to have different amounts of resistance to flow when somebody brings the flow, when they bring the flow inside. So each one of these stand for a different type of device, as you can see on here. So a lot of resistance is going to come from Handy Inhaler, Easy Inhaler. These are all brand names. Medium resistance from Twist Inhaler, Turbo Inhaler from Pulmicort. Symbicort is medium resistance also. So we got medium, high, medium. We have low, medium for Ellipta. And then our low or our zero, as you can see here, is just like an MDI. So that's going to show them how slow they need to take their breath in. So let me give you a quick example how this works. This is a one-way valve made by the same company. So airflow direction is only going this way. They can't blow back into it. So this is a multi-use device right here. That's really great. So it can be used in multiple patients. So this mouthpiece would need to be cleaned, or you can get new mouthpieces, or they can just seal their mouth on this. But I'm going to show you a little bit. Let's say, in my case, I'm going to do inhaler. So I'm going to do the zero there. Put this on, and I'm going to take this breath in. You're going to see this red thing move as I take the breath in. So hold it. Start with it all the way down. I'm going to take it slow. You see that's a little bit low, but somewhat optimal. The lower, the better for MDI. So let's see what most of your patients take your MDIs like this. You see that's getting into the yellow section for MDI, so that's not good at all. But the problem is that if they're taking a DPI, they need to generate at least 30. So let's look at DPI now. I'm going to take the breath. And that was a pretty quick breath in, and that was about 40 liters per minute. Now, a lot of your patients might not be able to do that. I'm going to do as hard as I can. I'm going to show you there's a lot of resistance here. And that's just pulling through the, actually that's zero resistance. That's just pulling through the zero. Now if I put them on, let's say, very common. Let's go to a Handy Inhaler, Spiriva Handy Inhaler. So that is the purple waves. So we're going to go to put the arrow on the purple waves. There's the arrow right there. Let's put it on the purple waves. Okay, let's see. Oh, I was doing the MDI wrong. Let's do the MDI again. So arrow on the zero. Let's do the MDI. That was really slow. You see that came up right to the middle of the MDI. Let's do the DPI though, purple. This is really hard to hit. So I pulled as hard as I could and I got about 40. Now that's, I don't think my lungs are weak, but yeah, so about 45 by pulling pretty fast. That's what they need to pull. They need to pull at least 30 to be able to get their Spiriva to actually work. Great thing about this, it's a great trainer. Put them on this, have them do their MDI. Teach them that slow for their MDI, and then see if they can actually pull the right amount of flow for the long-acting bronchodilator, long-acting anticholinergic, steroid, or whatever you're putting on, combo, triple combo, quadruple combo, quintuple combo, whatever they're going to be on. And there'll probably be a quintuple combo someday. I don't know what it would be, but we'll figure it out. So, but to get that DPI, they've got to be able to pull through resistance and get a certain flow. So this is a great device for that. It's called an in-check device and commonly used with a lot of COPD and asthma education. But if you're working in an office and you're prescribing MDIs or DPIs, these need to be used. It's really, really important. Thanks for watching.